I want to welcome everyone. I am Edith Solomon. I am a rabbi and founder of Hasidah, and I'm very happy to welcome all of you here tonight for our discussion about men and infertility. We're going to jump right in introducing in a moment after I just say that if you do have questions at any time, I think in Facebook you can enter them in. If you are here in our Zoom meeting, please, you can submit questions to myself or to, if you see the name Ariel in there, you can submit to them and we are happy to facilitate questions. So that's our technical stuff. I want to move then and welcome our panelists so we can begin. I'm going to start with Dr. William Petok, Bill. He has worked in the field of fertility since 1985. He's a licensed psychologist and he practices in Maryland and focuses on reproductive health issues, including fertility and sexual function. He really has a specialist in male reproductive health. He is, and one of the things he's done, in fact, he's even worked on co-producing films for training therapists and various other aspects, but I thought that was interesting in a film for training. And he's also served on the board of Path to Parenthood for 10 years. And he's also on the executive council for the Society of Assisted Reproductive Technology. He's really an expert in the field and we're really grateful to have you here today. Another person, thank you, Bill, for being here. Another person we have here on our panel is Dr. Stan Honig. He is a urologist. He is the past president of the Society for the Study of Male Reproduction and the current president for the Society of Male Reproduction Urology, which is a subgroup of the American Society of Reproductive Medicine. And he's the chairman of the Sexual and Reproductive Committee of the Urology Care Foundation. I'm reading all of these for you to get the idea. One of the things that I realized I said to someone the other day is that urology kind of reminded me of obstetrics, and as much as to say that it's about reproduction, but I realized, but we have reproductive endocrinologists, it's really different. And not every urologist deals with fertility. And this is something that Dr. Honig really focuses on. He actively participates also in clinical and scientific research about male reproduction and has spoken also what I thought was interesting about the economics of male infertility. And he is an active member of the Sexual Medicine Society of North America, the American Society of Andrology, and the Society for the Study of Male Reproduction. He is a leader in the field. We're very happy to have you here today. Thank you, Dr. Honig, for being here. And we also have Adi Lavy, and he is here with me in the Bay Area, and he and his wife had their own personal experience navigating through infertility, and he comes with his experience in the various aspects of this, and he can address his own personal experience. And we also have Aron Wolgel, who is a rabbi like myself. We will not be serving in rabbinic capacities today. He also had an experience with infertility and his journey towards parenthood. And he's also going to share tonight a bit about his experience. So thank you to our panelists for being here tonight. And I want to just start, I introduced by kind of saying what your role is, and I'm hoping you can just spend like 1 or 2 minutes talking a little bit about your role here and what is kind of the significance, maybe in your own words, about this experience, why it's important to you, and I'll leave it at that, about your being here, your experience, and why you think this is significant for us to be talking about this tonight. So why don't we start with you? Why don't we just go in the order that I introduced you? Bill, can you start for us?
Sure, I'll be glad to. Well, as Edith said, I've been working in the field of reproductive medicine since 1985. And early on, it became quite obvious to me that on the psychological side of services where I'm located, men were underrepresented. If you look at my organization, the Mental Health Professional Group, we are about 97% female. And it seemed to me that with infertility being, well, somewhere between 45 and 50% involving a male factor one way or another, that was an underrepresentation, and it felt like the right place for me to be involved, working with the male side of things. And as I've practiced more and more, it's been very rewarding. I've gotten to meet really interesting people who are very bright, like Dr. Honig and some of his colleagues, and been able to work with them, and worked with a number of very interesting men as my patients. It's been very rewarding, and I think an important thing to do.
Thank you. Dr. Honig, can you follow up with that?
Similarly, first of all, June is Men's Health Month, and I think it's important to stress the fact that men don't go to the doctor as often as women do, and women tend to be caretakers for their partners. And men kind of stop going to the doctor after their parents stop taking them to the pediatricians. Between 18 and 40, they stop going to the doctor. And then kind of at 40, if they have kids, maybe they have a vasectomy, or if they're struggling with infertility, they may see a doctor, but then they start thinking about their health. So one of my passions is just stressing the importance of men going to the doctor, taking care of themselves, things like that. And I've taken an active role as Dr. Petok has said. The male has been underrepresented in terms of care for him, even though 50% of the time infertility is a male factor. And we stress the importance of making sure there's not an underlying problem that may be affecting a male that may be the source of infertility, and also look for treatable, reversible factors that are important in addressing male factor infertility. So thanks for having me, and I look forward to answering any questions that we have from our group.
Great, I appreciate that. And I can tell you already, I know that one of the things we learned just from having this is that the difference in men between if it's male factor infertility or a male that is in a relationship where it may not be a factor of male in producing a child, and they overlap because it does take two no matter what. And that was one of the things we kind of found as a tension and an identity, and we're going to get back to that later. So thank you for mentioning there are issues just for men, and it's not just about women. Adi.
Thank you, Edith. Glad to be here. So my name is Adi. I'm here in the Bay Area. I'm here to talk about my experience. And me and my partner, we went through 4 cycles of IUI, and then continued to 1 IVF, which was successful, and we're expecting a baby in September. But it has been, thank you, it's been a long journey for about 4 years now. I mean, I've learned a lot through the process, a lot meaning the medical terminology and the process that you have to go through when you go through these processes, but also emotionally and mentally, and having discussions with my spouse, and just being there for her, and she's being there for me. So I'm here to talk about that. If anyone has any question, and I'll be happy to address it.
Thanks, Adi. Glad that you're here. Aron.
All right, well, good evening, everybody. Thanks, Edith, for welcoming me on the panel. Also, I have to say thank you to my wife, who encouraged me to do this. Really, I guess it was more that she asked the question if I'd be interested, and I said, sure. And that sort of startled her, that she was, that I was more willing to share my story and to talk with a large group of people, and I think that part of that stems from the fact that when I went through my journey, when we went through our journey, we're still going through, talking about this topic was something that was particularly difficult for me, and so I think my reason for being here, I don't know if that sounds very whatever. One of the reasons that I'm here, I should say, is to really just be a reflection point on our journey, and personally, I'm hoping to grow from this experience as well. The quick highlights, Cliff Notes version is we had a couple of years working towards when we finally were blessed with our twins. And then we had a second round of infertility, which unfortunately ended in a loss just this past, I don't even remember timelines anymore. COVID sort of threw all that off for me, but I guess it was about a year ago. And we were about to start another round, and sort of had to take a pause for a second for our own, self-care. And so that's where I am. And like I said, this is one stop along the way of our journey.
Thank you, Aron. And I'm also glad I like the way you shared that, because I think that one of the issues that often happens, that I experience, is we don't focus on the care that men do need to take during this journey, whether it is medical or emotion or whatnot. And I like that you said we needed to take care of ourselves, because I think that that's kind of the reality about the role that men often have. So maybe I'm going to actually start there. I have another question, but I think that's a good one. I think that a lot of times we do have the stereotype that these are stereotypes that, men don't have to ask for help, and we tend to burden men with being strong and not necessarily being in touch with their own emotions or asking for help, and that there is a discomfort of talking about it. It just doesn't, there are not many forums. So I think what I want to actually touch on first on there is, because of these sensitivities and the stigma around it, and that we're not talking about it, I want us to actually kind of name it. What aren't we talking about? And I think all of you can answer a bit of that. What are we not talking about?
I would defer to Adi and Aron first.
So I think we can compartmentalize that depending on who we're not talking with. So, with my wife, for example, I would talk about everything or anything. And the question is, maybe for more of outside people, like friends or family, some of them I might tell that we're going through a process or a journey, but not really giving in more details. Just because it's like admitting something that you don't want to admit to someone on the outside, I guess. But yeah, that might just differ, depends on the level of closeness to that person.
Well, I would say that I think it's just really hard. I think we have to name that, like, first and foremost. And it's hard for so many reasons. I think for me, one of the, something that my experience centered around was trying to navigate that balance between what is personal and what is private. And usually when we talk about areas surrounding the bedroom, that's assumed to be private. And it's not something that's really openly talked about. I mean, certainly not, 7-10 years ago, 15 years even, but now you're starting to hear a little bit more, but it's very much in smatterings. I think that so there's sort of my role as the sharer, and then the person who I choose to share it with, right? That they don't know how to respond to it either, right? And so in many cases, I think it was just a lot easier to not talk to other people, because then I wouldn't have to make things awkward for them, because they wait, you're telling me about this, that, am I supposed to ask a follow-up question now? And people really they get stuck. And so I think that it's really hard, and in some ways not talking about it felt easier, right? I could take on the role of, I was supporting my wife, and I needed to care for her needs, and that empowered me in one sense, right? I felt great because it it was a really positive feeling, and it made me feel strong, especially in our case where the issue was because of me. And so the fact that I sort of got to ignore it, or put it on the back burner because I had to help care for her, that's something that I didn't talk about. And then another thing that I didn't talk about would be just like, what does it mean that like so much of the process was centered around her, and she's the one taking all the shots. I had to give them to her. I tried to help as much as I could. I'd call for logistics and make appointments, but like, for sure, that's not an even trade, about everything that she was subjecting her body to. And I think that, well, I for sure didn't have the language to talk about it. Like, I didn't have anybody who had shared with me that I could say, oh, I learned from this person, this was a helpful tool. So we were just sort of, flying by the seat of our pants and making it up as we went. And every so often we'd get very lucky that somebody would share something, and somebody would turn out to be an outlet, or somebody else would be a connection point. But I think all of that, at least in my experience, sort of happened to me. I know that my wife was much more proactive in seeking it out. And I knew, like, in the back of my head, like, yeah, I should seek it out. But I think it was sort of like, when the question is out there and you don't even know what question to ask. So I knew I needed to seek something out, but I didn't necessarily know who to look for, or even once I found them, what to talk about. And so I'm going to go back to my topic sentence, which is, there's a lot of really hard things about this. And each one on its own is hard, and then put them all together and it exponentially increases.
The two of you have talked about three things which I think are critical: privacy, protection, and language. So it's an incredibly private matter. Having a baby is, everybody knows when you have a baby, how that baby came about, or mostly they know. Something happened in the bedroom, but you don't talk about it. And that's normal. That ought to be a private matter between two people. Now, all of a sudden, when you're working with a urologist, a reproductive endocrinologist, a whole team, it's no longer private, which can be, I think, terribly embarrassing on one level, and difficult to know how to talk about on another. And then, Aron, you mentioned protection. If you're a man in a heterosexual marriage, you're assigned a role culturally, and that is protector. And you're supposed to protect your wife. And as you noted, she's going through all of these shots, all of these things. Where do I get off talking about how I feel? Because look what she's enduring. And so we're sort of cast in this role of protecting others. And the final thing was, how do you come up with the language to talk about this? We don't get very good education about male reproduction. We know what we're supposed to do and what the net effect of that is, but the plumbing, if you will, is usually a mystery to us. If you're a woman, when you reach puberty, you get a whole education one way or another about what's happening with your reproductive system. Stan will tell you that the first time many men learn about their own reproductive system is when something goes awry, and you're referred to a reproductive urologist, who then says, let me show you what the system is. So missing language, assigned a role of protection, and this impingement on privacy are three things that are very, very difficult, I think, until you have the language and the comfort with it, and the understanding that it's not just me, it's a whole bunch of other people as well who are impacted by this.
I mean, two things that come to mind for me is, number one, I like to put things into perspective for the male, in that if he has a problem, I try to compare it to, a medical condition. So it's not this isn't like you can't provide, you can't be the provider like Dr. Petok is saying, but just like you have a gene for cancer, or you have a gene for heart disease, or you have something like that, you may have a medical condition, even though we don't know exactly what it is, but that it's not under your control. So I think that kind of takes away some of that anxiety of the male in terms of him feeling like it's my fault or things like that. The second thing that I think is important is just to show a mutual respect for your partner. So, not everyone is on the same page at the same time. So there may be points where the wife wants to move forward much faster than the male, and the male isn't ready. And there has to be a mutual understanding. And this is where seeing someone like Bill Petok is very valuable, where the male is just kind of figuring out what's going to, and it'll be like, well, let's do it at our own pace. And the wife may be crying every time she gets her period. And there's this disconcordance in terms of the relationship and how they're dealing with it. So I always stress to the couple that you have to respect each other. Sometimes the partner has to be understanding that the male isn't quite ready to move forward. Vice versa, the male has to understand that the woman is thinking in terms of a biological clock. Now, if the woman is 39 or 40, it's my job to tell them that you got to move faster, sooner. If they've only been trying for 6 months and the pressure is on from the partner to kind of move things forward, but the male isn't ready, it's my job also to kind of put things into perspective that maybe, it may be better to kind of go at a little slower pace. So each case is individual, but I think those are the type of things that I try to stress to patients when they come in for an initial evaluation.
And I think you pointed out something really important, which is that it's very unusual for both people in a couple to be at the same place emotionally at the same time. And because one is here and one is here doesn't mean they don't care about one another. It just means they're in a different place, but there has to be some understanding of that. So, you bring that up with your patients, and I do the same thing with mine.
And thank you for that. It's one thing, by the way, I just want to note, which is relevant, and we'll come back to it, is I did notice that the therapist mentions the medical plumbing, and our medical doctor talks about the emotions. And I think, by the way, that speaks volumes to me, because this is a ping pong when you're going back and forth. It is a medical procedure, like they're inseparable. This is a medical situation. It might not have been precipitated by something medical. There's many reasons why some people could be here. It could be genetic. There are a whole host of causes, but it is medical. The solution is medical, and it is emotional, and they're so intertwined. And it speaks volumes to both of you, by the way, about your awareness of recognizing that. And I think sometimes that's very hard for people to go through that and to get their hands around it, because one moment you do have to be focused on the medical, and then one time it's like the emotions are not there. I want to go back for a minute, however, to something both Adi and Aron mentioned, which was talking to friends, actually. And because Adi, you kind of asked the question about who are we talking about this and the details. And Aron, you talked about something which I think is very common, about when you want to share something and feeling like, well, but I'll be putting them in an awkward situation, and how do people respond? I'm wondering if you're comfortable, clearly you don't have to name names, but could you talk about any of your experiences of what it was like sharing with family or friends? I think that would be enlightening.
Yeah, I can go first. So I actually, among my friends, I shared our experience or journey with a couple of friends that they went through a similar journey. And that's interesting because they chose to share with me before I went through that journey. So maybe they were the more brave ones to share with me, and then I knew that they went through the same thing, and then I could talk to them about it. And so definitely applause to them. That made it a lot easier actually to talk to them, because I know that what they went through, and I also felt a bit better, asking maybe for their advice, or usually even if I didn't ask, they would tell me their advice, and that's kind of interesting thing. I think in many cultures, especially I could say that about the Israelis, even if you don't ask for their opinion, they would tell you what they think and give you like 100 recommendations. And if you don't care, don't want to hear it, which sometimes is another barrier, that you don't want to share these things because you just don't want to hear all their tips that are totally irrelevant. Like they would tell you that, oh, I know someone who adopted a dog and then they got pregnant. So what? Like, who cares? But I heard a couple of these. And as for family, I didn't even share the journey with my brothers or sister. Like only my mother knew about it. And I think mostly because she was asking what's going on, when can I expect a grandson or a grandchild? But I shared it with her, not all the details, of course, and just kind of where we are, that we're taking care of ourselves, that we are seeing specialists, and we're trying to get there. But I don't know if my siblings were surprised or not. Actually, I kind of told them just after the fact. Maybe, I don't know, maybe they went through the similar thing. I don't know, because they didn't share it with me.
Am I hearing, interesting, I don't know if I'm hearing this, so I want to say it, is when you talked about sharing with your mom, it almost sounds like to some degree, there was an opening for you to share because she's asking, but
Yeah.
that could just be like every mother's going to ask it. But it's interesting to me. It sounds almost like your response was a way of saying, yes, there's something, but I'm reassuring you. It was also kind of a way of answering the question, but keeping a little bit of a boundary for yourself. Was I hearing that correctly?
Yes, you were.
Okay. Interesting. Did it work?
Pretty much. Like every once in a while, she would ask, so any updates? I said, nope, we got an appointment. Things are under control. We'll get there.
Okay.
She's not too pushy.
She's trying, but over the years, I've learned how to handle it.
So, it's interesting when you talked about like how did I find my friends, or how did I pick which friends I wanted to share with? I really actually struggled a lot with that. I mean, that fits because it's in line with everything else I've shared so far. But I would say in the community that we were living in at the time, many of our peers, contemporaries were having children, and then we were getting older, and they were having their second kid, and we were getting older, and maybe some of them were even onto their third child already in some cases, and we were getting older, and we're with each other still, right? And so I think within the community, it was a sort of smaller group that people probably guessed or figured some things out, and that was when I would say the fun really started, because people would start sharing unsolicited advice. Stuff like you should change your underwear, or you should wear a particular type of wear boxers instead of briefs, which is perhaps there's some science behind it, but felt to me like I don't.
For the record, there's no science behind it.
Thank you but like I didn't even know the guy's name, and here he was sharing this advice, and so I think that was something that was also very off-putting. Or we would go to a celebration of other friends, and we legitimately tried with every fiber of my being. I wanted to just be happy for them and to enjoy and rejoice in their celebration at the time, and their happiness. And inevitably somebody would come up to me and say, so when's your turn, right? Or some sort of question like that. And I think I heard it enough times that I just said, yeah, I'm not interested in talking like this. Like, this is, who are you? Like, what is your intention in bringing up a conversation this way, right? Because it wasn't that they were offering empathy. It wasn't that they were saying, hey, I noticed that we haven't celebrated for you yet. Is everything okay? Which, by the way, also would have been off-putting, but, even in a caring way, right? If I didn't have a relationship with them already. And, I want to try to normalize this and make it be something that is just another conversation piece, right? I think that's as I understand it, one of the goals of having a panel like this is so that topics, like this can be talked about more openly. And so if I want to talk about a movie, I find out who else has seen that movie. If I want to talk about a book or, a particular thing that I've learned, then, I find out who else has learned that. And then we can have a little back and forth. But I didn't really ask, hey, who else is struggling with infertility? That's, there wasn't a forum for that. And, I feel very grateful that I did have some close friends that I could share with. And I think the way that I shared with each of them was a little bit different. And the more that I shared, I started to feel more comfortable with just like using the regular terms, as opposed to, we're having difficulties right now, which meant a million things, versus we're going through our, third round of IVF or whatever the things were at the time. It just made it a lot more concrete. And it made it a lot more, I think, palatable for the people that I was talking to, because it sort of opened the pathway that if they didn't want to talk about the feelings or the emotions piece, which, by the way, is important to talk about. And I want to, my wife's probably laughing that I'm saying this, but this is something that I've learned along the way, right? It is very important to talk about that and to be open and honest with that. But at the same time, the avenue of, wait, so like, what's that process even like, can actually be an intellectual connection as well. And, I think that one of the biggest pieces is there's so many different ways to connect, and there's not necessarily one correct formula either. So the intellectual connection can be very valuable. The emotional connection can be very valuable. I'm talking like with people who aren't the spouse or partner. But also with the spouse and partner as well. But in those times where, like, we've heard before, if people aren't on the same page, so then it sort of is easier to talk to somebody else outside, because there's no other assumption of, wait, I'm not in that place right now, I can't have this conversation, because they sort of become, a support exclusively, almost, in that regard.
But, Adi talked about something very different from your experience, Aron, and that is that someone had disclosed to him that they had had similar experiences, which automatically makes it okay for you to then talk about it, because assuming it's somebody you know and respect, and they've disclosed that, so now that opens that door. And you make a very interesting point, which is, what's the purpose of doing a forum like this? It's to make it more open. One of the difficulties I think we have as men is that there are not large numbers of highly visible men who talk about their reproductive experiences. If you're a woman, you know about Celine Dion, you know about Chrissy Teigen, you know about any number of very famous women who have had reproductive challenges, but the number of men is very small who have been very public about it. And that doesn't open a door then. If, I don't know, if a baseball star had talked about his reproductive challenges, then it would make it okay for me. Or if a musician that was popular had done that, it would make it okay for me. But without that door being open, it makes it harder to walk through it. And then again, it goes back to language, I think. How do you talk about what's going on? People obviously came up to you well-intentioned and said, so when is it your turn? Which is so highly offensive. When I hear it, I go, how do you do that? They're so well-meaning, but they don't understand that it's horrifying on some levels. I'll let you know when I'm ready to talk about it, but you can't even say that. We're working on it. And then somebody says, well, do you need instruction? And then you're really upset, right?
Dr. Honig, Stan, I have a couple questions for you following up on this. One, and I'm going to ask you both, you can answer them. And one is, this is your profession, medically speaking. And I'm really curious what your experience has been about men who come to see you specifically for reproduction in this issue about talking to others. And also, I just thought you may get that specifically, or like, do you even disclose you're a urologist, or do you speak about the fact that you focus on male reproduction? Because there's a lot of awareness in what you do. I have to admit, when I first talked about, urology with people, I never even thought about male factor infertility in my life. It was not until much later in life that I even thought about that. And of course, the second question has to be boxers versus briefs. What other myths do we have that we have a forum here? What are there some really basic things that we need to say and teach that, like, come on, like, what do we need to know?
Well, to answer your second question first, I have a series of like Dr. Honig's natural kind of remedies for male factor infertility. And, one of the most important things is I say, anything you do in moderation is fine. So, a lot of people are like, their wives tell them, you can't have a drink, you can't have a cigarette, you can't do anything. And my feeling is, no, you can have a glass of wine. You shouldn't have a bottle every night. You shouldn't have 3 drinks a night. You shouldn't have a case on the weekend. You want to have a cigarette here or there, that's fine. If you're smoking a pack a day, if you're smoking marijuana every day, that's potentially a problem. If you're taking anabolic steroids, you're taking testosterone, that's one of the things that lower sperm count. So, number one, I think one of the myths is that you have to stop anything bad, anything, people are afraid of caffeine. Caffeine is fine. It's no problem at all. So I think that the boxers and briefs is somewhat of a myth, but I really like to stress, the positives as opposed to the negatives. What was your second question? What was your first question again?
Could I actually just jump in real quick about that to add one other point? One other myth that came up a lot of times, people would say, wait, what's your profession again? And I would tell them I'm in education. And they said, oh, of course, teachers are always stressed. All you got to do is not be so stressed, and then it'll work for you. Take a vacation, take a this or whatever. And I don't want to dismiss that idea, because I think actually there's a lot of wisdom behind the intent, like you said, Bill, it was like well-intentioned people. So I think that the sort of wisdom behind it is throughout the process, make sure that the lesson that I learned was make sure to set aside time for self-care. And so, which by the way, related to infertility or not, is just a good life practice. And so I think that sort of to piggyback off of what Stan was saying is that, the healthier life you can live is just good for the life that you're living. And whether it helps the infertility piece or not, that isn't really, I don't want to speak to that point. But the reality is, like, take that time for care, make sure to exercise, make sure to, like, I'm still trying to remind myself this, now even, and, make sure you challenge your mind and all those things that are just parts of good, productive, healthy lifestyles. And so that's where, a steak every once in a while is delicious, unless you're vegan. It could still be delicious, you're just missing out, right? But I think that's, or you have, I don't know, tofu or something. But like whatever the pieces are, like, do it in a healthy way, in moderation and all that. And don't underestimate the importance of how valuable those stress relievers actually are.
Yeah, I mean, I think that all the things that, like for instance, stress per se is only going to modulate things a little bit, okay? But it may create problems in the bedroom too. So I'd say 20% of men that have a male factor issue will have problems with some level of sexual dysfunction when they're trying to be intimate with their wives. The other thing that I find is that a lot of times people are only being intimate when they're trying to get pregnant, okay? And the rest of the month, when they normally would be intimate maybe once or twice a week, they just they're going to opposite corners of the house, and because they kind of want to save it up and things like that. So I stress to people that, you know, it's okay to have intimate relations other times of the month. Timing things is important, but, you know, stress, I think, can be a factor, but it's not the ultimate big factor.
I would piggyback on that and say that there is very little data which suggests stress causes infertility. There's one very recent study in an animal model that suggests there's some set of neurotransmitters that may have a very, very tiny role in mice. So there's a long way to proving that's true in people. On the other hand, infertility and its treatment is incredibly stressful. And so, you know, they do go hand in hand. It's just one's not causal of the other. And Stan's point about intimate relations, I think, is really critical, because what tends to happen, as he said, is there's that 5-day fertile window, and that's where all the sex takes place. And then there's the rest of the month when you could be intimate in some other pleasurable way, which could be stress reducing, as long as you're not linking sex and unsuccess in your head, so that every time we have sex, it turns out to be unsuccessful because we didn't have a baby. There's some mental work that takes place to disconnect those two things so that one doesn't mean the other.
Thank you. That was very helpful. By the way, I've been jotting down a lot of the advice. At the end, I'm going to share with you how much advice, which was really helpful, that you all have shared. The question that I had asked Dr. Honig, which I asked you, was about when we were discussing how it was about the talking about infertility and the language of it. And I think that I had asked you about, for example, when people ask you what you do and you're speaking about male infertility, you have a lot of that, in as much as it's just not something that we talk about. And the opening doors, I think they were both sharing about, you know, if people do talk about it and it's not something discussed. So I was curious about your experience speaking with patients and just our awareness about the medical issues involved with this. And I was also just curious, and it might be enlightening, is, do you share with people you're a urologist, or do you tell people that you focus on male reproduction? And I'm curious the reactions to that, because I have to confess also, it would have been much later in my life that I would have even thought that a doctor had to deal with that.
I'd say, to answer the second part first, I mean, I'm a urologist, but I specialize in male reproduction. So yeah, a lot of people are like, well, how did you get into that field? And, you know, it's a very rewarding field. I mean, there's nothing better than trying to help a couple get pregnant. Now, we can't always help the couple, but, you know, I try to look at myself also like the oncologist who gives palliative care in terms of getting them through their difficult times. So, you know, if they can get pregnant and I can help them, that's great. If I can't help them, but I can refer them to an IVF center and they get pregnant that way, great. If they can't, there are other options. I mean, they can use a donor, they can use donor sperm, they can adopt, they can have child-free living. And I usually, you know, I think the average urologist, you know, they're mostly focused in on like just solving a problem. Whereas I try to take the approach of, number one, my goal today when I first see you is to examine you and go through your history and make sure that there's nothing serious going on. 1% of patients that show up may walk into the office with testicular cancer or some other medical issue. So number one, they may not know that, but that kind of allays their fears. Number two, I try to put things into perspective in terms of, I go over their numbers in detail. So a lot of them will come with a sheet where they haven't really had a full understanding of what's going on. I try to start with something along the lines of, as long as you have sperm, we have options to get you pregnant. Okay. And I say that I can't promise that I'll get you that way, but I'll, do my best. And also patients that have no sperm, there are options where you can either retrieve sperm if there's a blockage, or you can reverse something, things like that. So I try to put things in an optimistic point of view to start, where many of them come in, they've gotten the result from a sperm semen analysis, and they don't really know what to make of it. And I try to give that positive spin to start things off.
So when it comes to people coming to you for the reproductive aspect of this, is that where most of your referrals come in? Someone does a semen analysis through the reproductive endocrinologist, and that report says, now go see a urologist?
That's most of the time where I'm seeing patients, either from a reproductive endocrinologist, an OBGYN. We're seeing men coming in saying, I want to get checked. Okay. There's also kind of a transition period now where there's a series of home tests. So historically, you had to go to a lab, drop off a sample, things like that. And you can imagine, I'm sure that Adi and Aron, just when they dropped off their first sample, they were, kind of besides themselves, just kind of going through this as, comedies on TV, dropping off the sample, running in, getting stuck in traffic, things like that. They're not perfect tests, but they're screening tests. So it allows the male to do a test at home. Some of them are just a color change, yes or no. Others, you can put a drop on a slide, connect it to a device that you hook up to your smartphone, and it can actually give you a count and motility. Some of them are mail-in tests now, so you can just do it at home and mail it in. So the technology to allow men to do this in the privacy of their own home has been evolving, let's say, over the last 3 to 5 years, where that was really not available 5 to 10 years ago. So, and people are savvy, they go online, they do these things. So more and more we're seeing this type of thing, not just referrals from reproductive endocrinologists and OBGYNs.
I do like hearing that some people come in to get a health check, because women are kind of required. And I'm not aware of that being very common. It's good to hear.
Not. It's not, unless they're trying to get pregnant and they're not being successful. So some of them are proactive. Some of them are being told by their wife, get your behind in to have a sperm test. Okay. So a lot is, it's all individual in terms of what people are doing.
Yeah. So I have a question for you, Dr. Petok. If you could speak a little bit more to this concept of man as protector and that role. The question was, do you have any advice for how a man can make space to feel his own feelings while still serving in that role as protector? Is that even possible?
Oh, I think it's absolutely possible. I think if two things. So we're tasked with being protectors. We're tasked with being problem solvers. That's what we're supposed to do. We're supposed to solve problems. So infertility is a problem for which you don't have a solution because you're not medically trained. So that's not an unusual situation. Secondly, I think many men are afraid to say to their wives, I feel bad about this. And when I talk to wives, inevitably they say, I want to know how he feels because I'm worried he doesn't have any feelings about this at all. And that would be awful. That would mean he doesn't care. And usually when I talk with men about this, I will say, it takes a very strong man to talk about how he feels. Many men have this model that only weak men talk about how they feel. And they also have the notion that feelings are only negative. So, when your wife wants you to talk about how you feel, she wants to know what's bad, as opposed to, she might want to know what's good as well. So I'm thrilled that, we got the analysis back and the morphology was 30% good. That's fabulous, as opposed to I feel horrible because there's only 30% good, you know. Stan will tell you, it just takes one. So I think it's having the strength to take that leap of faith that she's not going to throw you out of the house because you feel bad about what's going on. In fact, she may respect you even more. So I'll have that conversation, typically with the man alone, not with his partner there. And then I guess part of it is, you know, having the vocabulary. How do you, most men have three feelings: happy, mad, sad. And, you know, there's a lot more nuance to that. Both Adi and Aron will tell you that infertility treatment is a lot of hurry up and wait. And there's a lot of pressure to get things done, and then you sit around and wait a long time. Well, that's incredibly frustrating no matter who you are. It's frustrating if you're the provider. It's frustrating if you're the patient. It's frustrating if the nurse is getting all the calls about why isn't it moving faster. So it's okay to be frustrated. It's not a bad thing to be able to identify a feeling which is uncomfortable. Go ahead.
I was just wondering, would it be fair to say that when I was hearing the question, what part of me was wondering is they seemed mutually exclusive. And I think what I'm hearing from you is that they're related. And as much as part of the beauty of sharing feelings is it does allow for a vulnerability that creates a safe space, which in and of itself is a form of making someone feel safe and comfortable.
It's an incredibly intimate thing to do, to reveal your vulnerability to a partner and allow her to support you, even in her own grief, sadness, whatever negative emotion she might have, that frankly, that might be distracting a little bit to her to be able to support you. And women typically don't, in my experience, don't get overwhelmed if their husband is sad about what's going on. In fact, they're not overjoyed, but it's not they feel bad because that they've been let in to be supportive. It does even things out a little bit.
Can I first off say that part of what you said was exactly our experience. Her wanting me to share a lot more. I think on the one thing that I want to temper that statement though and add a little bit of nuance. I think it's important for the husband also to be able to give boundaries to what he feels, or sorry, meaning like for me, it was helpful to have a boundary of, you know, I've shared up to what I'm comfortable sharing right now. I don't have the language for it to be able to appreciate her question, but also like once I started sharing, she wanted to know everything. She's like, oh my gosh, he's in talking mode. I want to listen to everything. And she wanted to ask it because, you know, it came about so rarely. And one of the things that we sort of had to figure out is I said, look, you know, it's important to talk. I get it. And sometimes I want to be able to say, I'm not ready to talk about that yet. And I think that's also healthy. And that's also important to give the guidance. And honestly, it wasn't always because it was difficult, right? Sometimes we had just had some sort of result or something, and I was really, really hopeful and optimistic. And you know, like to me, it was like, okay, great. So it's just a matter of time until this is going to work. And sometimes she wasn't in that same place with me, right? This is a theme that came up in one of the earlier questions. But that was also difficult for me to share in those regards. And so I think that, you know, sort of recognizing, and it's almost like before you have the conversation, take a step back and sort of set up the ground rules for, okay, so how are we going to support each other? Because, you know, do you want me to listen? Do you want me to help problem solve? Am I trying to, you know, is this a time where I'm supposed to address the needs and, you know, you want a distraction, or you want me to delve deeper into it? Or is this just you needing to share and I'm just, you know, the receiver, right? And I think that there's so many different roles, and it really is just like a huge roller coaster, just, you know, going from one to the next and one feeling to the next and one role to the next and all this. And I think, you know, the more transparent and the more honest we are with, okay, here's where I am right now. really maybe I would even say the more present we are, it really helps to give the best chance for the couple moving together in a coordinated way.
So I
Makes a
want
lot of sense.
pull out one thing that you said there, and because I'm going to start, I'm hoping that each of you can maybe just close with what you thought for your own personal experience, or what you think in your professional experience is the most helpful advice. Like for you, what might be the most helpful advice you got or you want to give, and the same. But while you do that and you're thinking about that, I'm going to share something you said, because it's one of the pieces of advice that I share in my years of working with clients, men or women, is the issue of boundaries. And you brought that up just now. And we speak about, as part of our spiritual care, is recognizing that without boundaries, you cannot have wholeness. If you're a wall, like if you're a cell, and if you just have a wall, you die. Nothing can come in. And it's the same thing. Like if you're an emotional wall or all these things, like you just can't survive. And at the same thing, if you have no boundaries, you're nothing. And the boundaries when going through infertility could be financial boundaries, time boundaries, emotional boundaries, physical boundaries, how many procedures boundaries. There's so many of them. But I think what you point out is also in our relationships with our partners, and with other people, what we're going to share, what we don't want to share. And that going through this, it's something important to think about. And I think it is important for men to realize that maybe it's a little bit different in how we go about them, but where are your boundaries? And it doesn't mean that they have to stay fixed, but if you just know where they are, you're much more likely to be able to get what you need when you need it, or know that. Just something I heard in what you said, which I think is so important and helpful. So I want to put it out as a last question as we wrap up our hour, and see if anyone would like to share one short little piece of advice.
Yeah. So I would say that from my experience, the whole journey and the whole difficulty is it's very isolating. So it's not just that we have to deal with it kind of on our own because it's a private matter, but on top of it, at least for us, because we relocated from another country, we don't have so many friends as we would have back home, and our families are not with us. So even furthermore, it's more isolating. So within that context, I think that it's important to remember that we, as the male side of the couple, have equal responsibility or equal same amount of sharing the burden, sharing the journey. And it's also up to us to do the emotional support of our partners, listening in, sharing from what we feel, but also being the positive side, and try to bring the mood back up when needed, and really drive the process forward, and basically help continuing and moving on, and try to go through another cycle if needed, just to bring whatever support that we can. So that's kind of how I felt during the times that we tried.
Thank you. Thank you so much.
I think from my perspective, number one, seek out specialty care where people can look for treatable, reversible causes of male factor infertility. Number two, just reiterating what you're saying about the boundaries, but at the same time, respect your partner. So if you don't want to share and she needs you to share, there is a point where it's important to share, but it's also important for the other partner to respect the fact that you don't want to share. So I think there's a give and take, and that's where something like where Bill Petok comes in, it's very valuable. And three, last but not least, is just stay positive, because in 2021, we really can just about help everybody. There are financial constraints. There are people that can't get pregnant, but I just stress to people to try to stay positive. And those are the 3 points I like to finish with.
Thank you. Thank you.
I would add to that if it is uncomfortable to talk to other people outside of your marital relationship, find a place to be anonymous. Look for an online community where your name doesn't have to be known, your face doesn't have to be seen, where you can see that you are not alone, because you are not. And knowing that there are other people going through something very similar, if not the same as you, can be very empowering, and may make it more possible to talk with the person who cares about you the most. So, that I would echo what Stan says about staying positive, and again, having qualified specialty care is just critical. And ask for a specialist referral to someone, or know what find the resources online to get those referrals. So the organization I belong to, the organization Stan belongs to, we have websites, so you can find somebody who does what we do pretty much everywhere in North America.
Okay. Thank you. I'm
So,
going to follow up on that in a second.
So I would say that my wife and I sort of had a mantra that we repeated, or motif maybe, that we came back to multiple times, which was, I love you, I'm here for you, we'll get through this together. And so having that as a sort of, and it was hard to say at times, right? I mean, it was really hard to say, and it was hard to hear also sometimes. But it became a very good grounding for us, and something that we returned to many times. The one piece of advice that I would say is a sort of metacognitive stance, which is that this is your story, right? If you're going through this, but it's not you, and I think that creating that distinction is really valuable. That this is a part of who I am, right? It's like I think it was Stan's earlier comment about the medical, calling it a medical issue, right? But it's not me, right? I am not this, but this is something that I'm dealing with. And I think having that distinction in the language is really, really helpful. Both for staying positive, as we've heard a couple people mention, but also in terms of moving forward, right? It means you don't have to change anything about yourself. There's no problem with you, but there is something difficult that you're working through right now. And there is something that is going to take time and attention and effort and perseverance and resilience. But it's that thing that you're focusing your attention on. It's not you. And I think that's really, that would be my advice for anybody who's struggling with this, really for anything, but this one is our panel tonight.
Thank you. That is really, really beautiful. I want to first thank our panelists, Dr. Petok, Adi, Aron, Dr. Honig. Thank you so much for being here. I learned a lot, and I really appreciate all of you sharing your expertise, your experiences. And I want to mention that earlier someone talked about, Aron, I think you had said, like, if you didn't have a relationship with someone, asking that it's okay, I see we're celebrating for others, are you okay? And I thought really the key in there is that's because you don't have a relationship with someone. And then you also mentioned later about, Adi, you mentioned that someone had disclosed to you, and I saw Bill picked up on that. You're doing that right now. By speaking, you are opening up and creating those relationships with these professionals, with us and with others, and you are putting it out there. We are disclosing. So I'm extremely grateful. The power of your speaking today is going to have a major ripple effect. Dr. Honig, you mentioned that you have like a little guideline of healthy things that you hand out. I'd love to be able to send that out to anyone who's interested following up with that. And Bill, you mentioned websites that both you and Stan are involved with. I'd love to be able to share those resources with our listeners. And I want to actually just close with, I'm going to take Aron's words. And as much as this was brought to you from Hasidah, and we are here, our name means chesed, it means stork. And it is an act of love that we are here doing this. So that's kind of our organization's way of saying we love you, and we are here for you. And I hope that we can get through this together wherever it leads you. For those of you watching, you are not alone. We are here for you. Thank you so much for coming.